Give me one sec, guys. Sorry about that. Okay, so the correct choice is B, check the MAR. Okay, check the MAR. Not asking the patient. But if the patient is confused, right? So it's checking in the MAR. That's where you document, confirm the medication administration. Nurse giving any medication, whatever the dose given, the time it was given, the route it was given, any assessments done, for example, if it's a blood pressure medication or blood glucose medication, or the numbers, all that should be there. All right. Sorry, guys, I'm getting calls and messages. There is an issue at the pharmacies. At one place, you have the internet shut down completely. You can't process any prescription, anything at all. And then another place, there's a water dispenser, the leakage, the floor is flooded. Okay. All right, next question. I guess once again, I have to take it. So B is the correct choice here. Let's move on to the next one and let me answer this call. Right, guys, so C is the correct one here, that you compare the patient's wristband with the medication administration record, the MAR, and ask the patient to state their date of birth. So always two patient identifiers. Okay, it should be an easy and breezy. Nice, nice, nice. Good job, good job, good job. Okay, great. Yes. Use always a certified professional medical interpreter, not a coworker, not the family member. We do not want to alter the information while we're trying to pass it on to the patient. Okay. Now these domains get confusing as well. So please make sure you understand which one is what. Great, super nurses are on fire. Good, great job, guys. Great job. Uh, whoever answered so far answered correctly. Not everybody answered. So let me go over that. Cognitive domain, the mental processes like your memory, comprehension, problem solving. So nurses primarily addressing these aspects to promote the understanding, learning, decision-making abilities. Okay. Okay, well done. Yes. B is the correct choice here. Correct choice. So this domain focuses on acquiring and processing knowledge, involves activities which promote understanding, remembering, thinking. Okay. The second domain of learning, affective domain. Okay, excellent. B is the correct choice. Emotional and social interactions involves the feelings, attitude, emotions, social interactions. We already talked about cognitive previously, which involves memory, comprehension, problem solving. Physical skill coordination, that is associated with another one we'll talk about. And basic physiological functions has nothing to do with it. Okay, that's okay. That's a psychomotor. All right, you guys got it right. So this was the third one, which I did not cover in the previous one, which involves physical skills and coordination. C is the correct choice. So these involve the tasks which require manual physical dexterity, maybe proper hand washing techniques, medication administration, or some therapeutic exercises, whatever, when they have to do something. Okay. All right, C, the patient successfully draws up the insulin and administers the injection correctly because it requires learning skills, both mental, physical activity. Um, so the patient learned, applied, so they did it, performed it. Okay. Okay, nice. Yes, tolerance. Tolerance, tolerance, tolerance is the correct choice here. Mhm. Okay, I want you guys to read the question again, please. Okay, now I see answers changing. Okay, the question is asking, due to risk of potential hepatotoxicity, what they can take safely. Now, which drug can put the patient at risk of hepatotoxicity, liver damage?
Tylenol.
Tylenol. So Tylenol is crossed out here. That's not a choice. And the comparable option would be NSAID. A, NSAID. Could be ibuprofen, naproxen, because they don't cause the hepatotoxicity. But if the patient has a cardiac condition, then you cannot give them NSAID, then the choice would be Tylenol, acetaminophen. Okay, is that clear to everyone? Any confusion on that? All clear? Okay. Now once again, find the keyword. Okay, yes, well done. Constipation is the most common. Know the keywords. They can throw those in as most common, most severe, that kind of stuff. So just don't jump on conclusion before you can clearly understand the question. Once again, find the keyword. Okay, nice. Yes, C is the correct choice here. Here, the keyword is severe adverse effect, and severe adverse effect of opioid is respiratory depression. Okay. Okay. Yes, again, great job. Everybody got it correct. Naloxone is the correct choice here. C, naloxone. Okay. Okay, nice. Yes, great job. B is the correct choice here. And acetylcysteine or acetylcysteine, same thing. That's an antidote for acetaminophen toxicity. Okay, great job. Yes, C is the correct choice. That they should take it as soon as they feel discomfort. They should not wait longer because then they will require a higher dose of pain medication, which can increase the risk of adverse effect. We don't want to do that. So they should take it right away as soon as the discomfort begins. Okay, calculation. Fun. Oops. Oh my goodness. Okay. Okay, yes, everybody got it right. 10, 10, 10, 10, 10, 10. Here you go. All right. Another one. Oh, is it the same one? It looks like the same one, right? Oh my goodness. I made Wrote it twice. Why? Okay. Okay, I'm still missing about 10 students not responding. I want to remind again, guys, don't make a mistake. Okay, B is the correct choice here. Status epilepticus, when the patient is not compliant with their medication. Okay, next one. All right, yes, B is the correct choice. Phenytoin, adverse effect, gingival hyperplasia. Guys, okay, here you go. Next question. Okay, yes, everybody got it right. A is the correct choice. We know that gingival hyperplasia problem. Okay, next question. Okay, well done. Yes, flumazenil. Choice A is the correct one here. Okay, next. Okay, well done again. D is the correct choice. Yellow, yellow, yellow. Jaundice is the problem. Yellow color is what? And indicate and clay color stools as well. Okay. Yes, C is the correct one here. Veracity. Telling the truth. The nurses are responsible for providing patients with accurate, honest information. Okay. Yes, B is the correct choice here. Well done. Question the prescription, discuss the concern with the provider. Next one. Yeah, great job. Potassium, yes.
Yeah. And 2 if possible, please. If possible, yeah.
For 2 different areas, 2 different.
Same. Oh.
All right, guys, here, okay. While caring for a patient with hip replacement, which medication the nurse planned to administer for DVT prophylaxis? And I see majority answered A, which is not the correct choice. It's enoxaparin, heparin, low molecular weight heparin. For DVT prophylaxis, it's always that, okay? Especially your hip surgery, knee replacement surgeries, that's what's given. It's a very common use. Warfarin, you may see that somebody has it and you want to prevent further. That's when you see warfarin, but not in that case. Not for any immediate, because for warfarin to work, it will take about 5 days to build up in the system. Okay, majority if you answered D, but let me clarify something here. The patient has iron deficiency anemia, so they will be given an iron product, which is ferrous sulfate, right? Now, ferrous sulfate, if you consider D as an option, will take the ferrous sulfate meals to prevent stomach upset. Well, they may have stomach upset and it can be given, but that's not the primary concern and that's not the primary recommended instructions. Okay. The first thing is to how to fulfill the gap. The gap is what? They're deficient in iron, right? How can we fill that? And that can only happen if they are able to absorb it. Now, food is going to decrease the absorption. Then we need to look into the option that what can increase the absorption. That's what they're asking here, not to minimize the abdominal discomfort. The target is to increase the absorption here. Okay? Because you are trying to fulfill a gap there, the deficiency. And when you consume ferrous sulfate iron, with orange juice as vitamin C, that will increase the absorption. And that is the reason B is the correct choice, because it gets absorbed well in acidic environment. And orange juice has vitamin C, which increases the acidity in the stomach, eventually increasing the absorption of ferrous sulfate. And that's what the target is. Does it make sense? Yes, or still not? Try to understand the question here. What the problem? What are we trying to fix? They're not concerned about the abdominal upset here, that, and there's no indication about that in the question either. The concern is somebody deficient in something. How can we make sure they're not anymore? So how can we provide them sufficient? And that's where this vitamin C comes. Okay. Excuse me. Okay, great job. Yes, B is the correct choice here. Constipation. Okay. Let's try another one. Okay, yes, absolutely correct. Once again, B, constipation. AC, air conditioner. AC causes constipation. Aluminum, calcium causes constipation. Okay, another relevant question. Yes, B is the correct choice here. Diarrhea. Magnesium causes movement. Diarrhea. Okay. Excellent. Yes, C is the correct choice here. So take empty stomach, because it's a protectant. It forms a protective barrier. Okay. Okay, yes, once again, great job, guys. B is the correct choice here. You know that it is because of fast infusion. So you slow it down first. Do we know how slow?
1 hour.
60 minutes, right? Yeah, okay. Let's actually take a break before we start this diabetes chapter, okay? We'll start after. So let's take a 15-minute, okay?